Welcome to section 1 of cardiac pathology. In this section, we'll be discussing hyperlipidemia signs. We discuss familial hypercholesterolemia and the biochemistry of lipids in much more detail in our biochemistry section. So go check that out if you're looking for a more basic understanding of lipids. Let's begin with xanthomas. These are localized deposits of lipids, which may manifest as nodules, plaques, or papules. In this condition, inflammatory cells engulf lipids, resulting in a broad range of histological findings, such as foam cells and lipid-laden histiocytes. When xanthomas occur on the eyelid, they're referred to as xanthelasmas. So this is a xanthoma that occurs on the eyelid. Xanthomas may also appear over the tendons or ligaments, and when this occurs, they're referred to as tendinous xanthomas. The Achilles tendon is frequently affected. Lipid deposition can also occur within the cornea, which results in a circumferential gray or white ring, and this is termed corneal arcus. These are commonly seen in the elderly. Now that we've discussed some of the signs of hyperlipidemia, let's move on to discuss management. This is the most important slide, so pay close attention here. If a patient presents with any of the signs we just discussed, you should immediately be thinking about the underlying cause. These signs may indicate that the patient has a lipid disorder, so alarm bells should be going off in your head, and you need to do a thorough evaluation in order to prevent complications that may arise from hyperlipidemia. For example, if you see a xanthelasma, you should be asking yourself, does this patient have hyperlipidemia, and will he or she be at risk of developing a heart attack or a stroke in the near future if left untreated? You should also be concerned about a familial lipid disorder and should consider screening other family members. So for management, you'll want to get a fasting lipid profile, gather a detailed family history, and perform genetic testing. All right, now that we've covered the information, let's review with a question. A 28-year-old previously healthy female presents to the clinic due to a cosmetic abnormality on her left eyelid that she first noticed several weeks ago. Physical examination reveals a yellow plaque on the surface of the left eyelid. What is the next best step in the management of this patient? A, EKG, B, prescribe antibiotics, C, fasting lipid profile, or D, incision and drainage. From the question, hopefully you notice that this patient has a yellow plaque on the surface of the left eyelid. This is consistent with a xanthelasma and is concerning for hyperlipidemia. So the best next step is C, a fasting lipid profile. This will allow us to determine if the patient has hyperlipidemia and provide appropriate management, such as administration of a lipid-lowering agent. A is incorrect because this would only be indicated if ischemic heart disease was suspected. While hyperlipidemia is certainly a risk factor for developing ischemic heart disease, this patient has no signs or symptoms consistent with this diagnosis. So A is incorrect. B and D are wrong because these are referring to a stye, which is a bacterial infection of the eyelid. Sometimes these can be treated with antibiotics and incision and drainage. However, a stye would present with a red, swollen, and painful eyelid, which this patient does not have. So B and D are incorrect. So again, the correct answer is C, fasting lipid profile. And that concludes this section.